The sterile halls of St. Mary's Hospital had seen countless miracles, but nothing could have prepared Dr. Sarah Chen for what happened when therapy dog Max refused to leave room 312. The patient, 45-year-old teacher Jennifer Walsh, had been cleared by 3 different doctors. But Max knew something they didn't. It was a crisp Tuesday morning in October when Jennifer Walsh arrived at St. Mary's Hospital for what she assumed would be her final follow-up appointment. The autumn air carried the scent of fallen leaves, and golden sunlight streamed through the hospital's tall windows, creating patterns on the polished floors. Jennifer wore her favorite burgundy sweater and comfortable jeans, having deliberately chosen clothes that felt optimistic for what she hoped would be a day of celebration. 6 months earlier, Jennifer had discovered a small lump in her breast during a routine self-examination that she performed religiously on the first day of each month. The moment her fingertips had detected the unusual tissue, her entire world had shifted. As a 4th-grade teacher at Roosevelt Elementary School, she was accustomed to helping children navigate difficult situations, but nothing had prepared her for the overwhelming terror that consumed her that sleepless night. The weeks that followed had been filled with anxiety-inducing medical appointments, each test bringing either momentary relief or renewed worry. She remembered sitting in waiting rooms with Mark, her husband of 20 years, both of them trying to maintain optimism while secretly fearing the worst. Their teenage children, Sarah and Michael, had sensed the tension but hadn't been told the full extent of their mother's medical concerns. Dr. Sarah Chen, the hospital's chief oncologist with over 20 years of experience, had personally reviewed Jennifer's case with meticulous attention to detail. At 52, Dr. Chen had guided thousands of patients through similar fears, and she approached each case with scientific rigor combined with genuine compassion. Her office walls were decorated with thank you cards from grateful patients, reminders of lives she had helped save and families she had helped heal. The medical evidence in Jennifer's case had been consistently reassuring. The mammogram had been completely clear, showing only dense breast tissue that was normal for her age. The ultrasound had revealed the cyst, but its characteristics showed none of the concerning features that might indicate malignancy. Most definitively, the fine needle aspiration biopsy had come back negative for malignant cells, with 2 different pathologists confirming the benign nature of the tissue. Jennifer sat in her hospital bed that morning, already dressed in street clothes and ready for discharge. Her blonde hair was pulled back in a neat ponytail, and she wore a genuine smile of relief as she organized the paperwork Dr. Chen had given her. After months of worry, sleepless nights, and the constant fear that had haunted her thoughts, she was finally ready to reclaim her normal life and put this frightening chapter behind her permanently. There was someone else in St. Mary's Hospital that morning who would challenge everything the medical team thought they knew about Jennifer's condition. His name was Max, a 4-year-old golden retriever who served as one of the hospital's most beloved and effective therapy dogs. For the past 2 years, Max had been bringing comfort, healing, and moments of joy to patients throughout the medical center during some of their darkest hours. Max's journey to becoming a therapy dog had begun when he was just 8 weeks old, born to champion bloodlines that had initially destined him for competitive dog showing. However, his temperament had proven too gentle and people-focused for the demanding world of conformation competition. His original breeder, recognizing Max's exceptional emotional intelligence and natural empathy, had recommended him for therapy animal training instead of showing. The Healing Paws Foundation, a respected non-profit organization specializing in preparing animals for medical environments, had accepted Max into their comprehensive 18-month training program. The curriculum was rigorous and multifaceted, teaching dogs advanced obedience, public access skills, and most importantly, how to provide emotional support to people experiencing trauma, illness, and fear. Max had excelled in every aspect of his training, displaying an almost supernatural ability to sense human emotions and respond appropriately. His instructors had been amazed by his intuitive understanding of what each person needed. With anxious patients, he would lie quietly nearby, offering calm stability. With lonely elderly patients, he would be gently interactive, providing companionship. With frightened children, he demonstrated remarkable patience and playfulness that helped them forget their fears. His handler, Rebecca Martinez, had worked with therapy animals for over 8 years and had never encountered a dog with Max's level of emotional intelligence. At 34, Rebecca had transitioned from pediatric nursing to animal-assisted therapy after witnessing firsthand how animals could accelerate healing and provide comfort that human caregivers sometimes couldn't match. Rebecca had been paired with Max when he completed his training, and their partnership had been extraordinary from the beginning. She had learned to read his subtle signals, the way he tilted his head when assessing a patient's needs, how he positioned his body to provide maximum comfort, and the gentle way he would rest his chin on someone's hand when they needed reassurance. That Tuesday morning, Rebecca and Max were conducting their regular rounds through the oncology ward, a routine they had established over many months. The cancer center was always emotionally challenging, filled with patients facing life's most frightening uncertainties. The therapy dog visits provided crucial moments of normalcy and joy in an environment that could feel overwhelming. They had already made several successful visits that morning. Mrs. Patterson in room 308, a retired teacher undergoing chemotherapy, had smiled genuinely for the first time in weeks when Max had gently placed his head on her lap. Young Tommy Martinez in room 315, a 12-year-old fighting leukemia, had laughed out loud when Max performed his repertoire of simple tricks, temporarily forgetting his illness and feeling like a normal kid again. When Rebecca knocked gently on the door of room 312 and asked if Jennifer would welcome a visit from Max, the teacher's entire face transformed with genuine enthusiasm. As someone who had dedicated her career to nurturing children, Jennifer had always felt a natural connection to animals and had often discussed with her family the possibility of adopting a dog once their busy schedules allowed. "Of course, please come in," Jennifer said warmly, setting aside her discharge paperwork and adjusting her position to welcome her visitors. "I could definitely use some positive energy before I finally leave this place. I've heard wonderful things about your therapy dog program from the nurses." Rebecca entered the room with Max walking calmly beside her on his distinctive blue therapy leash that identified him as a working animal. The golden retriever wore his official therapy dog vest with obvious pride, and his beautiful golden coat seemed to bring warmth and life to the clinical environment. His dark, intelligent eyes held the kind of wisdom that had made him so successful in his therapeutic work, and his tail maintained a gentle wag that invited interaction while remaining professional. The room was typical of St. Mary's patient accommodations, clean and functional, with pale blue walls designed to promote calm. Jennifer had made small attempts to personalize the space with yellow roses from Mark and a family photo from their recent vacation to Lake Tahoe, when life had seemed simple and cancer was something that happened to other people. But the moment Max stepped across the threshold into room 312, his entire demeanor underwent a dramatic and unprecedented transformation. Instead of his usual calm, measured approach to meeting new patients, which typically involved careful assessment followed by gentle introduction, Max became visibly alert and intensely focused with an urgency that was completely out of character. His ears snapped forward with precision, rotating like sensitive equipment trying to capture signals invisible to humans. His nose began working frantically, nostrils flaring as he processed complex scents that filled the room with information only he could interpret. Most remarkably, he pulled Rebecca directly toward Jennifer's bedside with a determination that bypassed all his careful training about approaching patients slowly and respectfully. The transformation was immediate and unmistakable. Max's extensive training had emphasized controlled, gentle interactions with vulnerable patients, but something had triggered an intense response that seemed to override all his conditioning. His body language shifted from therapeutic companion to focus detector, exhibiting behaviors that Rebecca had read about in medical journals but never witnessed firsthand. "Max, easy boy," Rebecca said quietly, genuinely surprised and somewhat alarmed by his unusual intensity. She tried to slow his approach, but Max was singularly focused on reaching Jennifer's bedside as quickly as possible. Max approached Jennifer's bed and immediately began what could only be described as a systematic investigation of her left side, particularly the area near her chest. His behavior remained gentle and non-threatening, but it was undeniably persistent and purposeful. He would focus intently on one specific location for several seconds, his nose working with the precision of medical equipment, then lift his head to make direct eye contact with Jennifer, his intelligent brown eyes seeming to communicate something urgent before returning to his focused examination. The pattern that emerged was both systematic and relentless. Sniff intensely, look up meaningfully, return to the same spot. The cycle repeated with mechanical consistency that was impossible to ignore or dismiss as random behavior. His body language displayed all the classic characteristics of what animal behaviorists term alerting behavior, the same focused indication that search and rescue dogs exhibit when they locate their target. Jennifer's initial reaction was nervous laughter as she reached out to stroke Max's soft golden fur. "He's certainly thorough, isn't he?" she said to Rebecca, trying to maintain lightness despite growing unease. But as Max continued his relentless investigation without any sign of stopping or moving to different areas, Jennifer's forced smile gradually faded and was replaced by visible concern. What made the situation particularly unsettling was that Max seemed to be concentrating his attention on the exact anatomical area where Jennifer's troublesome lump had been located 6 months earlier. The same area that had caused her months of sleepless nights and overwhelming worry before medical examinations had supposedly resolved her fears with reassuring diagnoses. Rebecca watched this interaction with growing professional concern. Her 8 years of experience with therapy animals had taught her to trust their remarkable instincts. She had witnessed dogs successfully predict seizures before any human-detectable symptoms appeared, alert to diabetic episodes when blood sugar monitors still showed normal readings, and provide early warnings about panic attacks before patients were consciously aware of their developing distress. "This is very unusual," Rebecca admitted to Jennifer, her voice reflecting both professional curiosity and genuine worry. "Max is trained to provide comfort and companionship, but I've never seen him exhibit this type of focused, persistent behavior with a patient. It's almost like he's trying to alert us to something specific." For 10 full minutes, Max maintained his position at Jennifer's bedside and refused to be redirected despite Rebecca's increasingly urgent attempts to guide him toward more typical therapy dog interactions. Every time she tried to encourage him to move to other areas of the room, perform some of his usual calming tricks, or simply provide general emotional support, Max would comply briefly but then immediately return to the same specific location with renewed intensity. The persistence was remarkable and deeply troubling to Rebecca, who understood that such focused, repetitive behavior in a therapy dog typically indicated the animal was detecting something significant that humans were missing entirely. Jennifer's anxiety was mounting with each passing minute. "Why is he doing this?" she asked, unconsciously placing her hand over the area where Max was concentrating his attention. "All my tests came back normal. 3 different doctors have cleared me. I'm supposed to go home today." Rebecca had worked with therapy animals long enough to develop complete confidence in their abilities to detect things that escaped human awareness. The specificity and urgency of Max's behavior was unlike anything in her professional experience, and she understood that dismissing it could be a serious mistake. "I think we should definitely mention this to your doctor," Rebecca said carefully, choosing her words to convey seriousness without causing panic. "Max has consistently demonstrated very reliable instincts throughout our work together. His training has made him extraordinarily sensitive to changes in human health and emotional states. This type of focused, persistent alerting is so unusual that I believe it warrants medical investigation." The timing seemed almost orchestrated when Dr. Chen entered the room at that exact moment, carrying Jennifer's final discharge papers and wearing the relaxed, professional demeanor of someone prepared to complete a routine consultation. She appeared ready to send a patient home with good news and renewed peace of mind. "Good morning, Jennifer," Dr. Chen said with the warm, reassuring tone she had perfected over 2 decades of guiding cancer patients through their most frightening experiences. "I have your completed paperwork right here, and you're officially cleared to resume all normal activities. How are you feeling? I imagine you're more than ready to put this entire experience behind you." "Actually, Dr. Chen," Rebecca interrupted with polite but unmistakable urgency, "I think you should observe what's been happening here before we proceed with Jennifer's discharge. Max has been exhibiting extremely unusual behavior since we entered this room, completely unlike anything I've witnessed in our 2 years of partnership." Dr. Chen paused in organizing the discharge documents, her expression immediately shifting from routine pleasantness to professional interest. She had collaborated closely with St. Mary's Therapy Dog Program since its implementation and had developed profound respect for these animals' remarkable diagnostic capabilities. Over the years, she had witnessed dogs provide early warnings about medical conditions that conventional testing had missed, including seizures, infections, and even metabolic disorders. "Please show me exactly what Max has been doing," Dr. Chen said, setting Jennifer's paperwork aside and moving closer to observe the interaction directly. Rebecca gently guided Max back toward the bedside, though guidance was hardly necessary given his obvious determination. The golden retriever immediately resumed his systematic behavior, directing his attention with surgical precision to Jennifer's left side. His nose worked methodically, conducting what appeared to be a comprehensive analysis of scents completely inaccessible to human perception. Every few seconds, Max would lift his head from his investigation and make direct, meaningful eye contact with the adults in the room. His dark eyes seemed to hold an almost human quality of urgency, as if he were desperately trying to communicate critical information that could mean the difference between life and death. Dr. Chen observed Max's behavior for several long minutes, her medical training helping her recognize the significance of what she was witnessing. The dog's actions displayed all the classic characteristics she had read about in medical journals describing specially trained cancer detection dogs: focused attention on a specific area, persistent alerting behavior, and obvious urgency that suggested he had detected something requiring immediate attention. While Dr. Chen maintained her commitment to evidence-based medicine and scientific protocols, she had also learned to remain open to information from unexpected sources, particularly when that information might impact patient health. Max's behavior was too specific, too persistent, and too urgent to be dismissed as coincidental or meaningless. "Jennifer," Dr. Chen said slowly and carefully, "I understand that all your recent test results have been reassuring, and I can imagine how confusing this situation must be. However, based on what I'm observing with Max's behavior, I would like to perform one additional examination and possibly order some supplementary tests." Jennifer looked between Dr. Chen and Max with obvious confusion and growing fear. The relief she had been feeling was rapidly being replaced by the same overwhelming anxiety that had consumed her 6 months earlier. "But you told me everything was fine," she said, her voice rising slightly as stress affected her speech. "The biopsy results were negative, the mammogram was clear, the ultrasound showed nothing concerning. You said I was healthy and ready to resume normal life. What could possibly be different now? How could a dog detect something that all your sophisticated medical equipment missed?" Dr. Chen pulled a chair beside Jennifer's bed, recognizing that this conversation would require patience and thorough explanation. There have been numerous documented cases in medical literature of dogs successfully detecting various cancers before they become apparent through traditional screening methods, she explained with careful precision. Dogs possess olfactory capabilities that are thousands of times more sensitive than human smell. They can potentially detect minute chemical changes in the human body that our current technology might not be sophisticated enough to identify, especially in very early stages when cellular changes are just beginning. She paused to let Jennifer process this information. Max's behavior is remarkably similar to what we see in dogs specifically trained for medical detection. His focus on one particular area, combined with his obvious urgency, suggests he may be detecting something significant that warrants our investigation. Jennifer's husband Mark, who had been quietly observing from the corner, stood up with concern evident in his voice. "Are you saying there might actually be something wrong after all these months of worry and relief?" Dr. Chen understood the emotional turmoil the family was experiencing, having guided countless patients through similar situations. "I want to be completely clear that I'm not making any definitive statements about Jennifer's condition," she replied with professional calm. "However, Max's behavior is specific enough that I believe we should be thorough rather than dismissing what could be an important warning." She looked directly at both Jennifer and Mark as she continued. "I would like to order a more detailed MRI scan using contrast enhancement that will allow us to examine the breast tissue with significantly higher resolution than your previous imaging provided. Depending on what those results reveal, we may need to perform a different type of biopsy that samples tissue from a slightly different location." Dr. Chen's tone remained reassuring while acknowledging the seriousness of the situation. It's entirely possible we'll find that Max is responding to residual sense from your previous procedures, or detecting something completely benign. However, I would rather investigate thoroughly and find nothing than dismiss this alert and potentially miss something important. The discussion that followed was extensive and emotionally challenging. Jennifer struggled with the prospect of undergoing additional testing just when she thought her ordeal was finally over. Mark grappled with the possibility that their relief had been premature. Both wondered how they would tell their children that the medical uncertainty wasn't resolved after all. Max seemed to sense that his urgent message was finally being understood because his intense alerting behavior began to moderate. He remained positioned close to Jennifer's bedside and continued his vigilant observation, but he no longer displayed the frantic urgency that had characterized his initial response. Instead, he settled into a more supportive posture while maintaining his obvious concern. After careful consideration of all the medical, emotional, and practical implications, Jennifer ultimately agreed to undergo the additional testing. Her discharge was cancelled, and she was scheduled for an enhanced MRI with contrast that afternoon. The procedure would be followed by a comprehensive tissue biopsy if the imaging studies revealed anything requiring further investigation. Rebecca remained with Jennifer throughout the discussion, both to provide emotional support and to observe Max's continued behavior. "In all my years working with therapy animals," she told Dr. Chen, "I've never witnessed anything quite like this. Max's level of focus and persistence suggests he's detected something very specific that he considers urgent." The enhanced MRI was scheduled for 2 p.m., giving Jennifer and Mark several emotionally turbulent hours to process what had transpired. They spent the waiting time in the hospital's healing garden, walking slowly among the carefully tended flowers while trying to make sense of the morning's events and prepare themselves for whatever the tests might reveal. The enhanced MRI procedure was significantly more comprehensive than Jennifer's previous imaging studies. The contrast agent administered intravenously allowed the medical team to examine her breast tissue with dramatically improved clarity and resolution, highlighting any areas where increased blood flow or unusual cellular activity might indicate abnormal tissue growth that earlier scans had missed. When the results became available 3 hours later, they revealed information that was both shocking and vindicating of Max's behavior. The enhanced imaging clearly showed a small but distinct mass that had somehow escaped detection in all of Jennifer's previous examinations. The newly discovered abnormality measured approximately 8 mm in diameter and was located in precisely the same area where Max had been directing his focused attention. Dr. Chen studied the detailed images with a complex mixture of professional amazement and medical concern. The mass exhibited several characteristics that were potentially troubling: irregular borders rather than the smooth edges typical of benign cysts, evidence of increased blood flow suggesting active growth, and a density pattern that differed noticeably from the surrounding normal tissue. "There is definitely something present here that we completely missed in all your previous tests," Dr. Chen told Jennifer and Mark when they reconvened in her office that evening. She carefully oriented them to the relevant areas on the computer monitor, pointing out the location and concerning features of the mass. "It's relatively small, which helps explain how it might have been overlooked during standard screening, particularly given your dense breast tissue. However, it's clearly there and requires immediate evaluation through tissue sampling." Jennifer stared at the black and white images displaying her own body in clinical detail. "How is it possible that something like this was missed during multiple examinations?" she asked, her voice reflecting confusion and fear. The tissue biopsy was scheduled for the following morning using MRI guidance to ensure samples were obtained from the exact center of the newly identified mass. The procedure was more complex than Jennifer's earlier biopsy, requiring precise positioning and continuous imaging to guide the needle to the correct location. When the pathology results became available 36 hours later, they confirmed both the worst fears and best hopes simultaneously. The tissue analysis revealed invasive ductal carcinoma, a malignant tumor that had indeed been actively growing despite all previous reassuring test results. The cancer cells showed characteristics indicating active division and growth potential. However, the news wasn't entirely devastating. Because the tumor had been detected at such an early stage, thanks entirely to Max's intervention, the overall prognosis remained very favorable. The cancer was small, appeared localized, and had likely not had time to spread to nearby lymph nodes or distant organs. If Max hadn't alerted us to this tumor when he did, Dr. Chen explained to Jennifer and Mark, it would have continued growing undetected for several more months before appearing on routine screening or becoming physically detectable. By that time, it could have grown significantly larger and potentially spread, making treatment much more complex and reducing cure rates. Jennifer was overwhelmed by the emotional complexity of her situation, terror about having cancer, profound gratitude for Max's detection, and amazement at the dog's extraordinary abilities. "That dog literally saved my life, didn't he?" she asked through tears. In the most literal sense, yes, Dr. Chen confirmed. Max detected something that our medical technology initially missed completely. His intervention has given us the opportunity to treat your cancer at its most treatable stage. The treatment plan developed for Jennifer was remarkably straightforward due to the early detection. She would require only a lumpectomy, a breast-conserving surgical procedure to remove the tumor along with a small margin of surrounding healthy tissue. This would be followed by a relatively brief course of radiation therapy to eliminate any microscopic cancer cells that might remain. The surgical procedure was performed 1 week later by Dr. Michael Rodriguez, the hospital's most experienced breast surgeon. The operation proceeded exactly as planned, taking less than 2 hours with no complications. Post-surgical pathology confirmed that the entire tumor had been successfully removed with clear margins, meaning no cancer cells were found at the edges of the excised tissue. Most importantly, examination of sentinel lymph nodes showed no evidence of cancer spread, confirming that the malignancy had been caught before it could metastasize to other parts of Jennifer's body. Her prognosis was excellent, with cure rates exceeding 95% for cancer caught at this early stage. Jennifer's recovery was rapid and uncomplicated. She returned home the same day as her surgery and was able to resume most normal activities within a week. The radiation treatments were administered on an outpatient basis over 6 weeks, allowing her to maintain her teaching schedule with minimal disruption. Throughout her treatment period, Max continued to visit Jennifer during her follow-up appointments. His behavior had completely returned to his normal therapeutic mode, gentle, supportive, and comforting rather than the urgent alerting that had characterized their first encounter. It was as if he understood that his crucial diagnostic mission had been accomplished successfully. The story of Max's remarkable detection spread rapidly throughout St. Mary's Hospital and into the broader medical community. Healthcare professionals, researchers, and administrators were fascinated by this unprecedented case of a therapy dog identifying undiagnosed cancer in a patient who had been medically cleared through conventional protocols. Dr. Patricia Moore, the hospital's chief of staff with over 30 years of medical leadership experience, convened a special meeting of the entire medical staff to discuss the implications of Max's discovery. The main conference room was filled with oncologists, surgeons, radiologists, nurses, and other professionals, all eager to understand how this detection had occurred and what it might mean for their approach to patient care. This case raises profound questions about how we might more effectively utilize therapy animals in our diagnostic processes, Dr. Moore told the assembled team. While we cannot abandon evidence-based medicine, this incident suggests there are valuable sources of medical information we may not be accessing. The discussion that followed was extensive and sometimes heated, reflecting natural tension between traditional medical approaches and innovative possibilities. Some physicians expressed appropriate skepticism about animal-based detection, emphasizing the importance of maintaining rigorous scientific standards. Others argued that Max's success provided compelling evidence for expanding research into medical applications of animal sensory abilities. Dr. Chen positioned herself as an advocate for taking Max's capabilities seriously while maintaining scientific rigor. "What we witnessed wasn't coincidental behavior," she told her colleagues. "It was a trained animal detecting something medically significant that our technology initially failed to identify. We have an obligation to understand how this occurred and whether it can be systematically developed." The hospital immediately began collaborating with the Healing Paws Foundation to develop protocols for documenting unusual behaviors exhibited by therapy animals during patient visits. They also initiated formal research partnerships with veterinary schools and medical universities to study the potential for systematic medical detection training. Rebecca found herself becoming a national spokesperson for the therapeutic and diagnostic potential of specially trained animals. She fielded calls from hospitals across the country wanting to establish similar programs and spoke at medical conferences about recognizing alerting behaviors in therapy dogs. Several additional cases were subsequently identified where Max's alerts led to discovering previously undiagnosed conditions, including infections, metabolic disorders, and 2 more cases of early-stage cancer. His success rate in detecting medical abnormalities approached 100%, validating the decision to take his behavior seriously. Jennifer returned to her 4th grade classroom 3 months after Max's detection, completely cancer-free and with a transformed perspective on life and the remarkable capabilities of animals. She had become a passionate advocate for therapy dog programs and frequently spoke to medical groups, parent organizations, and educational conferences about her experience. "Max didn't just detect my cancer," Jennifer would tell audiences with genuine emotion. "He gave me my future back. He allowed me to continue being a teacher, wife, and mother. Without his intervention, I might not have lived to see my children graduate, get married, or have families of their own." Her story resonated powerfully with healthcare professionals who were beginning to recognize that healing could come from unexpected partnerships between human expertise and animal instinct. Medical schools began incorporating Jennifer and Max's case into their curricula as an example of innovative approaches to diagnosis and patient care. The case had a profound impact on Dr. Chen's approach to medicine. "Max taught me that healing is both science and art," she reflected during interviews. "While we must maintain our commitment to rigorous medical protocols, we should also remain open to information from sources we might not have considered. Animals may have access to diagnostic capabilities that our current technology cannot match." The Healing Paws Foundation used Max's success to completely transform their training programs. They developed specialized curricula for teaching handlers to recognize medical alerting behaviors and established protocols for communicating effectively with healthcare teams when unusual behaviors were observed. Research into the medical applications of animal sensory abilities expanded dramatically following Jennifer's case. Universities launched formal studies examining how dogs detect diseases, what chemical signatures they identify, and whether their abilities could be systematically harnessed for medical screening. Max's detection had opened an entirely new field of medical research. The National Institutes of Health awarded significant funding for studies into canine cancer detection, with Max serving as the primary case study demonstrating the potential for these programs. His success had transformed him from a therapy dog into a pioneer of veterinary-assisted medical diagnosis. If this incredible story of Max and Jennifer touched your heart, please hit that like button and subscribe for more amazing true stories about the extraordinary bond between therapy animals and the humans they protect. These remarkable animals remind us that heroism comes in many forms, and sometimes the most important voices are those that never speak a word but communicate through pure instinct and unconditional love.